Today on Immunity Group Australia's podcast, we have a special guest from Singapore. Dr. Miina Öhman is a physician scientist and board certified lifestyle medicine doctor with over 25 years of research in cardiometabolic diseases conducted at leading universities in Finland, the US, and Singapore. Her extensive publications in top-tier journals cover critical topics: obesity, cardiovascular disease, and diabetes that are among the most pressing health challenges globally. And in recent years, Dr. Miina has dedicated herself to advancing lifestyle medicine, becoming board-certified lifestyle medicine physician in 2022. Welcome to our podcast, Dr. Miina Öhman.
Thank you so much for inviting me. Pleasure to be here.
For our listeners who may not be familiar with the word lifestyle medicine, could you please, in simple terms, describe what is lifestyle medicine?
Sure. So lifestyle medicine is a medical specialty that first and foremost is promoting using lifestyle modifications and interventions as a way to manage and treat and even reverse lifestyle-related diseases, which are usually these cardiometabolic diseases that you just mentioned: diabetes, obesity, heart disease. And the lifestyle medicine relies on 6 pillars. The 6 pillars are nutrition, the healthy diet, really like plant predominant diet, physical activity, restorative sleep, stress management, positive social connections, and avoidance of risky substances such as tobacco and alcohol. So the doctor, who is a lifestyle medicine physician, is really trying to work with the patient in a patient-centered manner to build a behavior change in the patient so that they will choose these health-promoting lifestyle options and choices for themselves. And the beauty of the pillars in lifestyle medicine really is that they work in synergy to support each other. So, for example, when you sleep better, you have much more energy to exercise. And then if you exercise, actually, that will improve your sleep. Or if you sleep better, you don't have so many cravings for example, sugary foods, usually. And then it's easier to improve the quality of your diet. And then stress management is hugely important for all of the pillars, as well as social connections, because actually social connectedness and positive social connections can support you when you are making the lifestyle changes. So you have more energy, the people that will that are on your side, so to say. Did that answer your question?
Yes, this is very interesting because a lot of doctors in the Western medicine traditionally haven't taken into consideration this holistic view. But in recent years, there is a lot of talk about microbiome and the holistic approach to medicine. So is lifestyle medicine a holistic approach to medicine?
Yes, definitely, it's more holistic than the Western conventional medicine is, which is so I was trained as a Western conventional medical doctor for sure, but in that modality, we as doctors usually we're just trained to use pharmaceuticals, pills or procedures, looking at the very especially in the specialist world, people look at a patient from a very siloed, narrow point of view, and don't see that, for example, the heart disease can be related to diabetes and things like this. So, and obesity actually drives all these diseases too. So, in a holistic way, you actually try to go more towards the root cause of these diseases. Because at the cellular level, so I'm a physician scientist, so I was really doing 25 years of research on the on the molecular level of these diseases, and they share a lot of the common pathophysiological pathways and molecules. And there's always chronic low-grade inflammation, there's oxidative stress, there's mitochondrial dysfunction. And then it really depends on your genetic profile a little bit, like which disease you're going to manifest first. But all of these are lifestyle related. And really tackling the lifestyle, we can prevent these, and we can take much better care of these if we have already developed these diseases. And if you really apply the lifestyle changes very intensely, you can reverse. You can get rid of your hypertension or high blood pressure, your high blood glucose, your high cholesterol levels, things like this, obesity. Yeah.
When it comes to childhood, what can we do to help the children, the next generations, not face the same problems as perhaps we're witnessing now with the whole obesity epidemic amongst children, especially in the Western world, but increasingly also, for example, in Southeast Asia?
Yes, so lifestyle medicine is applicable for the whole human lifespan. As well, to the children, the middle-aged people, and then to the elderly. So all will benefit. And especially in childhood, it's very important that we create the healthy habits, the healthy eating habits, physical activity, because if there's a lot of research from decades ago already showing that if we establish the healthy habits in childhood, it's much easier to maintain these habits into the adulthood. Or if there's like a time that you didn't do this, for example, in your early adulthood years, you can still more easily start exercising, for example, if you have done any of this in the past, in your childhood. And then, there's this whole microbiome thing that you just mentioned, that really establishing the healthy microbiome in the early childhood will really help you to maintain this throughout when you're growing. And actually, the benefits of healthy lifestyle start already in utero. So when you are the fetus in your mother's womb. And this is because, for example, let's take what is the mother's, just if they have, for example, gestational diabetes, which is also related to lifestyle a lot. The diet, the physical activity levels, a little bit genetics also. That if you're born to a mother that had gestational diabetes, you will have a greater risk in your life to get diabetes or hypertension or other metabolic diseases. So then you would really benefit starting the healthy lifestyle path already in childhood, because a lot of these diseases take decades to develop. And the earlier you start, the easier it is to keep them off, to prevent them. So there's less things to undo or reverse. Yes.
And please tell me about the Singaporean Society of Lifestyle Medicine. You're the president of this association. How did that come about, and what are some of your current campaigns or goals for the near and medium-term future?
So yes, we started Singaporean Society of Lifestyle Medicine last year ago, in 2023. And we're basically a group of people that came together, like-minded professionals that really want to promote, raise awareness of lifestyle medicine in Singapore, and connect with multidisciplinary practitioners that all want to practice lifestyle medicine. Because lifestyle medicine is best practiced not in silos, but really with these teams of multi-professional, multidisciplinary professionals. Because in the current medical system, the physical activity, for example, you would have a physiotherapist that knows a lot of these things, can help you train with that, create a training programs for your exercise. There are dietitians, there are psychologists that help with mental health. So one of the pillars was stress management and social connectedness. So these are actually related very strongly to mental health, because chronic stress, mental stress is really a risk factor for any kind of mental health disease. Also, your positive social connectedness helps to prevent mental health diseases. So so these different professionals can be the in addition to medical doctors, we can be members in our society. And we just had our first, like the inaugural lecture of our society a few weeks ago in Singapore. And we were very lucky to get the president of the American College of Lifestyle Medicine as our guest speaker, Dr. Beth Freites. And with a very short notice, we actually were able to really bring together like more than 100 people for this inaugural lecture and spread the word. And I think it's really bearing fruit now. We're getting more members and we're getting noticed more, and people are really interested in lifestyle medicine. So yeah, we're we're going forward.
That's wonderful news. And also there is probably Singaporean government's involvement in the future in some capacity. How does Singapore view lifestyle changes in their community, and are they concerned about obesity epidemic globally and in their country?
Oh, Singapore government has done wonderful work. Yes, they are very much aware of the chronic disease crisis. That's a global thing, right? Because of the aging populations, and these diseases tend to manifest later in life. Usually, although there are pediatric patients already with, let's say, fatty liver disease and pre-diabetes. But anyway, so mostly it's middle-aged people and elderly. And Singapore government has really, they declared the war on diabetes 8 years ago, for example, because they realized the diabetes prevalence was hiking up, and also obesity rates are climbing, also in the pediatric population. And they have really taken steps to trying to activate the population. For example, there's a National Steps Challenge and things like this, so that get the people moving. Also, they introduced nutri-grade like labeling on food packages, which foods contain, a lot of sugar, salt, and fat. Of course, there's more things that could be done, and the big idea to really transform the healthcare so that it will really put emphasis on the preventive health rather than the reactive sick care model, like it is now in many countries. It is. So the hospital care is the most expensive type of care, and no country can afford this in the future with the aging populations. Just taking care of after the diseases have developed and after the adverse outcomes have actually taken place, like heart attack, or if you have diabetes, you start to really have severe complications with your eyes or kidneys or even leg amputations. So to really prevent this, the government is promoting health screenings, first of all, so you can have an idea whether you already have a disease, whether you're on the way to develop it, and then take these measures to do something about it, which is, can of course contain the drug treatments, but really lifestyle is something that actually determines your health outcome on the long run, because 80 to 90% of the health outcomes, the factors that affect to that, they happen outside the doctor's office. And this has been known for, over 20 years already. So the so-called behavior health or social determinants of health are really a big component of how healthy you will be in the long run.
If we can go back to your homeland, Finland, and Finland is known to be on the forefront of many initiatives in the public health space in particular. How big is lifestyle medicine in Finland, and what is some of your experience from working in Finland and now in Singapore tells us about sort of that direction of public health research and practice?
So interestingly, the year that I was born, 1972, Finland, okay, there wasn't the word lifestyle medicine, but there were a couple of young doctors that got very worried about the cardiovascular prevalence, especially the myocardial infarctions, the heart attacks. Finland had the highest rate of ischemic heart disease in the world. in the 60s and early 70s. So at that time, it became evident that diet actually plays a big role in the risk of heart disease and tobacco as well. So the young doctors set up the so-called North Karelia project. So this Karelia is my middle name is Karelia. We pronounce it Karelia. So they set up this North Karelia project, and they went to the remote eastern parts of Finland, where the heart disease mortality was the highest. And they really started doing at the grassroots level the lifestyle medicine, like a national program. So they advised people to first of all stop smoking, and then people's diet was very high in saturated fat. So Finnish men especially used a lot of butter and lard, like fatty meats, butter for all the baking and all the dishes, and not much vegetables at all. And of course, they were heavy drinkers, and they used salt, a lot of salt in their food. So then also salt was already known it's a risk. High salt use is a risk factor for hypertension or high blood pressure. So these young doctors started advising people. They had these so-called group medical appointments. So they gathered people together and told them, like, you will die, in your 40s or 50s if you continue this lifestyle. At that time, people were not obese. I mean, these were like men, who could work in the, like a timber logging in the forest. So it's a hard physical labor still. They were not obese, but they still had the metabolic diseases. And they were able to, by advising people to really stop smoking, reducing salt intake, switching butter to olive oil, increase the vegetable intake, eating less meat products, processed meats and red meat, to really shifting their diet, and then also advise on exercise levels unless they were doing a lot of physical activity already in their work. And this project really turned the tide in the ischemic heart disease prevalence. And in the 2 decades that followed the initiation of this project, it actually spread to the rest of the Finland too, because the results were so remarkable in this North Karelia region. And this was one more thing, this was the time before statin drugs were there for cholesterol, hypercholesterolemia, or high cholesterol levels in the blood. So people really had like super high cholesterol levels. And they were able to reduce the cholesterol levels, reduce the blood pressure levels, quitting smoking, and really eating more vegetables and less saturated fats. And they reduced the heart disease by 80% in the next 20 years. If you track back.
Absolutely massive.
So it was huge. It was really huge. And this is, I know in epidemiology research, this is really widely known project, that happened. And I'm so proud. And then that's why I named Karelia Health my own company too.
Tell us about Karelia Health. What does it do, and what does it aim to achieve?
So I 2 years ago, I became board certified lifestyle medicine physician, and I really wanted to dedicate my life when I turned 50 to more really serve people and public health and the wider community to advance the lifestyle medicine, healthy lifestyle, because that really is the root of the problems in so many modern diseases. Our bad gut leaky gut, or bad gut microbiome, and chronic stress, and of course the physical inactivity, sleep disorders, problems. They're all kind of tied together. And so my company, I advise not only private clients, but also startup companies, and also I do consulting for bigger healthcare entities. Because, for example, in Finland, there are the certain healthcare districts that want to build these lifestyle medicine elements into their digital programs for their patients. So I do all this, and then I'm the president of the society. So yes.
I must also add, if I may, that you're actually a big advocate of public education. And I have seen many of your
Yes.
public comments on social media aiming to inform, educate, and empower general public with translational medicine. You support young researchers from all over the world who publish in the space of microbiome. And what I found fascinating is you draw on the possible limitations of certain research. I particularly liked your comment about mice, how some studies are done on mice during a particular time of the day. However, mice predominantly feed during a different time. Do you mind elaborating on that, please?
Yeah. So yeah, my research background is definitely more on translational or preclinical models rather than human studies. Although my PhD was in genetics of obesity or human genetics, so I have done human research as well. But really, so the mouse work is not many people understand actually that mice are nocturnal animals. So they do feed during the night, and then they, when during our daylight time, when in these research labs, usually the lights are on during our waking up time, right? And then no researchers are working during the nighttime when the mice should be eating and being active. So when these metabolic studies are done, it's always the question like, is this really a reflection of the human physiology that is happening? Because you are now feeding the mice, whatever you're doing and measuring, if it's measured during their sleeping time, it's a little bit controversial, right? And then there's many other factors. For example, the ambient temperature of the mouse facility, in these laboratories. So because that can also affect the metabolism of the animals. So there's many mice are not men are not mice, but if you want to study whole organism systems, then I understand the benefit of animal research, although I'm not big advocate of animal research anymore. But yeah, so anyway, human research requires a lot of resources to do, and the current trend is really to switch away from animal models to more cellular and even in silico models, like just done with computers, so to say. But yeah, anyway, so did I answer your question?
Yes, that was a great point.
Yeah.
I really saw a lot of debate on that particular issue, and it was fantastic to bring that up as somebody who has decades of experience in researching preclinical models. If we could please go back to one point which I found fascinating when you explained the 6 pillars of lifestyle medicine, and that is social connections. Now, that is not something that many physicians would ever talk about, and its linkages to mental health and overall metabolic health. If you don't mind, maybe expanding a little bit just on that particular pillar of social connections.
Sure. Yeah. So social connections, compared to so the other end is social isolation. So loneliness, in other words. So it's a different thing to feel comfortable in solitude, whereas like when you're actually lonely and socially isolated, if you like unwillingly. There are research showing that social isolation or loneliness is as big a risk factor as tobacco smoking for cardiovascular disease. It's huge. It increases the risk for 30%. And positive social connections, first of all, can bring us, safety, security in our life, predictiveness. And so we are not, so we are supported by other people is really important. And if we have positive social connections, we usually share time. When we spend time with these people, they can bring us, joy, happiness, laughter, and these are all good for our nervous system. to bring this parasympathetic nervous system activation, right? Compared to negative social connections or those relationships that do not really support us. Everybody knows to talk about toxic people, but really there is also this longitudinal Harvard University study on happiness showing, the 80-year-old study that really tracked what are the factors that contribute your longevity and happiness in life. And the number one thing was your relationships, to have the positive connectedness to people. And the modern medicine is not really digging deep into this, because I think it, to track something like for long term, first of all, and trying to measure everything at the molecular level, like we're now doing for everything, it would require, I don't know what kind of equipment and for decades of surveys, but it may play a role in many different aspects. Also, like if we're sharing meal times, for example, it's like in a family setting, it's been shown already decades ago, actually in obesity research, that if family shares a meal time together, these kids are in reduced risk of developing obesity in their life. So there's something that, usually families who eat together, they tend to have healthier connections, and, that can support, so kids will not feel, for example, they would not feel themselves lonely. They would, if the loneliness it's a stress factor for your system, because if you're isolated, that's, in a human evolution, that was a threat to your survival, actually. So you need other people. Humans are social beings, right? So, or any kind of bullying at, childhood, adulthood, it's a threat, right? And then how do you cope with that threat can lead to many negative health behaviors that you're trying to soothe your nervous system, basically, right? To protect you from that threat, bring some safety and sweetness in your life. You can go for sugary foods or whatever things that then, all the addictions that people have. Yeah.
Short-term satisfaction.
Because, yeah.
I hope, Dr. Miina, that more general practitioners and more physicians overall will pay greater attention to lifestyle medicine and the 6 pillars. Is there any upcoming event where we could invite Australian and other perhaps physicians, doctors, or practitioners in that space who would like to perhaps link with your association?
Well, I know in Australia there is the Australasian Society of Lifestyle Medicine. Yes, we would love to collaborate with them, and we will start. Our society will definitely start a webinar series very soon, and I'm sure we can make that webinar open to a wider audience, not just our members. Maybe it will be paid, but we're still in the midst of with working out all the details. And there will be more events as well. Now it's coming to the end of the year, so this is the busy holiday time everywhere in the world. Most likely, beginning of next year, we will have something bigger again, and yeah, just actively, I'm always, as I'm posting in LinkedIn whatever research I find really interesting, and try to support all the other lifestyle medicine practitioners, organizations, young scientists. I in the past, I've done a lot of the work for girls or women scientist space also. I think that's very important. But I'm really just advocating also stress management and all these components that have not been there traditionally in the Western medicine, to looking at that, like how important actually it is to take care of these things, because once you are on that slippery slope with chronic stress, your sleep starts to deteriorate. That wreaks havoc in your metabolism, in your immune system. It actually it's a stress for your system, right? If that's chronic, really you will get sick more often. That affects your inflammation level in the body. So the high sensitive CRP or C-reactive protein, which is a marker of inflammation, will go higher. And these are all the components. The oxidative stress levels increase in your body because it's an uncompensated stress in the body. If you're not getting enough sleep, your cortisol level will go higher. That's when you start accumulating belly fat more easier. And also you crave for sugary foods. And the sleep deprivation also affects your glucose metabolism. So there are all these factors that if they come together at the same time, all these pillars, then you're not eating well, you're not sleeping, then you're tired, you don't want to do physical activity. They start to accumulate and then get the snowball rolling towards that disease that then develops. So, yeah.
Thank you very much, Dr. Miina Öhman, for this very insightful interview. And we look forward to building more transcontinental, in a way, neighborly social connections between Australian and other practitioners and also your members.
Thank you so much.